Hi, this is Dr. Jones, and you're a brand new patient at our office. You came in, talked to us the first time, and then we sent you off for some blood work, and then you came back and we went over in quite some detail everything there was on your blood test, and we put you into some categories, and now you're off wondering, okay, what's next? Well, I'd like to review that with you. First, I'd like to thank you for coming to our clinic and giving us the opportunity to improve your quality of life. Most of our patients have been suffering a long time and not knowing what they can do with their health. So congratulations on taking a big step on doing something finally about your health. And as you know, we're not big on medications, drugs. We don't use that in our clinic unless there's an emergency going on. But we're using the bioidentical hormones, and we've told you all about those. So now, as we probably talked about just before you left, and I know when we go over all your blood tests, there's a lot of information that we gave you, and some of it may have gone in one ear and out the other. So I'd just like to review a couple things. So our staff probably gave you an appointment for about 3 weeks down the road. And what we want you to do between now and when you come back in again is, if you have any questions or anything's strange, don't wait the 3 weeks. Go ahead and call us, 801-576-1155. I'll usually call you back by the end of the day. If you have any questions as to how to take what you're taking or what you're doing, or a question with the pharmacy or anything, give us a call. That's what we're here for. That's why we want to help you to be the best you can be at feeling better. So when you come back in 3 weeks, I'm going to ask you some questions. And I might ask you if you had a problem with sleep before. I'll ask you, how's your sleep going? And a lot of women and even men say, oh boy, since I've started that progesterone, I'm just sleeping so much better. And I'll say, okay, that's probably about the right dose then, so we won't play with that dose. However, if you come back and say, well, I stay asleep better, but I'm still having a hard time falling asleep, then we might tell you, okay, take the progesterone an hour before you go to bed instead of taking it right when you go to bed. Give it a chance to work on your brain so it relaxes your brain. I'll ask you questions about, well, how has your period been? Have you had a period since you were here? How was it? Was it less cramping? Did you have less PMS? Because we're playing around with the doses. Every woman is different, so all the dosing is different. So we have to tweak things as we go. I'll ask you maybe regarding your thyroid. Are you experiencing a better energy level since you started on the thyroid? Most people will say, yeah, I feel a little bit better, because we started you off on a very low dose, because we want you on the lowest effective dose. So as time goes by over the next weeks and months, we're going to be playing with those doses and adjust it specifically for you. Because frankly, we don't know what dose you're going to do best on, because as I say, everybody's different. So these are some of the types of things that we want to work with as you come back. Now, when you come back after 3 weeks, we'll set another appointment after that. If you live a ways away, we can do that over the phone, or you can come in when you meet with either me or one of the nurse practitioners or one of the other doctors. Again, if you have questions during those times, give us a call. We're always there calling by the end of the day to give you any answers to any concerns you have. So again, we appreciate you coming in and trusting us with your health care. I know this is a big step. It's a commitment, but we want to know that you are committed to getting better. We're going to make dietary changes for you, because you can't just take the hormones and think you're going to get better. So when you come back, we're going to be talking about diet. We do have the series of 3 classes on Tuesday nights. They are consecutive, and our nutritionist, Connie, is incredible at what she teaches. She can teach you and answer a lot of your questions there. I don't have the time to go over all the details when I meet with you. That's why we do have the classes. So these are changes that, a lot of people ask, well, how long is it going to take me to feel better? Well, that's a very individual thing. If a woman is having hot flashes and night sweats and we put her on estrogen, she's probably going to not have hot flashes and night sweats that very night. That's a very fast reacting one. As far as energy and things like that, it can take us 3, 4, 5 months to figure out what are the best levels for you. So it takes us a while to balance you. That's why we see you for a whole year in the beginning. After the year's treatment is over, then when everything's set and you know exactly what you're doing, then we just see you twice a year. You just come in for a regular office visit. There's no upfront annual fee. We just have a regular office visit fee that you see. So again, if you have questions, give us a call. We congratulate you on making this step in your life to finally feel better for the rest of your life. Thank you very much.